Going to open the Human Service Committee meeting. I'm going to make a motion to approve the April 15th committee minutes if no amendments. Do I have a second? Okay, Vinny. Any discussion? All in favor, say aye.
Aye.
Any opposed? Moved. And then we are not doing a presentation today, and we are going to table the draft resolution. Is there anyone that had anything else? This will be the shortest meeting we've ever had. I will make a motion for an adjournment then. Do I have a second, Tom? Any discussion? All in favor, say aye. Any opposed? Okay, we're adjourned.
At this time, I'll call the General Services Committee to order. I would like a motion, or I'll make a motion to approve the April 15th committee minutes. Do I have a second? Thank you. At this time, we'll have a presentation from John Reed on Lewis County Bridge Plan.
We're gonna do the best we can here. Got to get it to turn on first. Hopefully it doesn't turn on. No. Thanks. Okay. Now, look at that, Tim. We're gaining. Connor. Hit what? Oh.
See if it does.
All right. Okay, here we go. So good afternoon. Today we're going to talk about what qualifies as a bridge, the stats, reasons to take over, selection process, and selected bridges. A bridge structure that has a deck span of 20 feet or longer. They are inspected by a licensed engineer every 2 years and have a 7-digit BIN number fastened to the wing wall, which identifies information about that structure. Lewis County owns and maintains 86 bridges. The towns in Lewis County own 31 bridges. Our goal is to take over 12 town, village owned bridges in Lewis County by our highway department. Lewis County Highway Department has a bridge crew. In the springtime, they wash and inspect every county-owned bridge. They document all necessary repairs needed. Throughout the summer, they complete the repairs needed as well as preventive maintenance measures, which prolongs the life of our bridges. Each bridge is inspected every 2 years. If the licensed engineer finds any defects on a county or town-owned bridge during their inspection, they send out different levels of flag ratings, which indicate the level of repairs needed, as well as they contact the county highway superintendent to make sure that the repairs are being addressed properly. This sometimes requires engineering plan for the repairs. Once the repairs are complete, photos are sent back showing the repairs, and sometimes another inspection visit is made to ensure that the repairs are complete. Once all satisfied repairs are made, the flag is removed. DOT encourages the takeover of town bridges to improve administrative efficiencies and maintenance. These structures are very expensive. Sometimes towns can't afford to make the repairs. If the bridge needs to be replaced, the local shares 5%, which on $2 million structure, that's $100,000. $100,000. And sometimes this expense is too much for the municipality, which results in bridge closures. These bridges become more and more expensive to replace as the DEC requires longer bridge spans to open back up the natural flow of stream beds. The BEDIS program, which stands for Bridge Data Information System. This program stores all information about the bridge structure. It is also a tool that the DOT uses to determine whether a bridge meets the criteria for replacement funding. I use this program as a tool to help me decide which bridges we selected to take over. I also visually inspected these structures myself to assure my decision. So here are the selected bridges. So in the town of Lowville, there's Bartle Road, McHugh Road, Bickford Road, and Gordon Road bridges. In the town of Croghan, there's the Long Pond Road and South Bridge Street. In the town of Linesdale, there's one on River Road. In the town of Martinsburg, there's one on Centerville Road. In the town of Diana, There's one on Jordan Falls Road. In the village of Lyons Falls, there's one on Fulton Street. In the town of West Turin, there's one on Sweeney Road. And in the town of Leiden, there's one on Brock Road. So here is a bridge before, during, and after pictures of a bridge that was recently constructed in 2024 on the East Road in the town of Leiden. The bridge cost $2 million to replace. Does anybody have any questions?
John, I think this is a really great thing. It's a great way for the county to help out the towns and, take some liability away from them and look into the future and have that vision, forward, to help them out and replace these liabilities. So great job.
Thanks.
Yeah, looking back at the road efficiency studies, that this was part of Andrew was the chair of, Josh, you were on it, I was on it. It's funny, back in 1985, they did these studies, but nothing really ever come of it. And I'm like her, hats off to you guys that are actually putting stuff into action.
Well, what we're going to do is we're going to start out. Right now, we're working with our bridge budget on our 86 bridges that we currently own. We're going to see how it goes. We actually chose bridges that were just recently rebuilt or in really good shape. So that's, when I went out and looked at them, I wanted to make sure that this wasn't going to take a huge impact until we get this first round. We will consider more bridges next year and maybe the year after, but we want to make sure our bridge department can handle 86 bridges that we take care of currently right now is a handful. By taking on 12 more, there's washing, there's cutting the shoulders to allow water to run off. There's sealing them. So this first round is a decent round of bridges to take on. So we may ask for more funding in the bridge budget to, help us out to make sure we're maintaining them because, as we know, we've got probably $200 million worth of bridges, if not more, that we're trying to, maintain. So we'll continue with the budget we have now for this year and see how it goes, but we may have to ask for more, but we'll have to see what happens.
I think to add with Herb and Tom is, I think it's a benefit for the towns and the county. A lot of these bridges at the town level, even the county level, you're talking, they were built 1930, 1940, they're going on, 90, 100 years old. And the towns, they receive $5,300-ish a mile in CHIPS money. And then a 30-mile maintenance budget, that's only $160,000. And then you get the POP money that comes with it. Again, you're looking at a bridge between $1 and $2 million. Their total CHIPS packages might be $200,000, and they're trying to maintain the roads they currently have, and let alone try and chip in 5% if they're successful, and the county helps administer the bridge grant portion of it. And the other side of the coin is a lot of these bridges that you may travel that are physically bridges are identified as culverts because they don't meet the span. They may be 18 feet, but with the new DEC regulations and criteria, they will become bridges for the towns, which is another large expense. So
along with that, so whenever we go and we have box culverts that we try to get funding for, sometimes they get bumped up to a bridge because they don't meet DEC codes and standards. So just keep in mind, there's a lot of box culverts out there that actually look like bridges, but they are less than 20 feet deck spans. They do not have a bin number. They are not inspected every 2 years. They are inspected by the town superintendent or the county superintendent by their team. And, sometimes DEC makes engineering bump it to a bridge because they're choking these, the box culverts are choking these streams down. So once it gets bumped to a bridge, then it actually is, it goes, you have to pay the 5% local fee where a lot of towns can't afford it. So they shy away from the project. Therefore, then the bridge, they're in bad shape in the beginning, and then their alternative is, what is the detour route around? So that they don't have to rebuild the bridge and spend money on it, and then when the bridge closures start to happen.
So, something else I think that's worth noting is, with the highway taking ownership of these and the bridge washing. So you're improving the longevity of these bridges as well, and making them last longer. So I think it's great all the way around.
A couple logistical items. All 12 of those are in this packet. And the way the resolutions are written is that they will not become ours until the town also passes the exact same resolution giving it. So if a town doesn't want to, they don't have to. I would ask the legislators to please take that to your towns and ask them if they would pass those. And if you reach out to Cassandra or I, we can get you an actual resolution for the town to pass that will give you the language that they need to pass, because we want to reference the bin number and the ownership transfer. So if you guys could do that, and if you represent a town, I know, Andrea, there's not one in Watson, but for example, the Bailey Road Bridge, when it gets done, that's one that we would consider taking, because now you can get it in a 75-year rotation and really plan for its replacement in the future.
Town of Wowell is in my district also. Any other questions from my committee? Thank you, John.
Thank you.
Very nice. At this time, we'll have a presentation from Josh Liviker on Lewis County EMS. Or John Levesque, I'm sorry.
Not really. Good afternoon. For those of you that don't know me, my name is Josh Levesque. I am the Chief of Operations for Lewis County Search and Rescue. I have been for 6 years now. Thank you. Just a quick bio, and the reason that I threw this in there is in EMS, many times the leadership ends up being just a paramedic that has the most seniority and ends up running agencies. So I threw up a little bit about myself. I'm a 97 graduate, or excuse me, that's wrong, 93 graduate of South Louis. I'm a 97 graduate of the United States Air Force. I was an offensive B-1, offensive avionics tech on the B-1 bombers out in Ellsworth. I left there and went into the manufacturing worlds, but the biggest portions of that, I worked in fiber optics for many years until it was purchased up by Anritsu in Japan and moved over. I then moved over to all wiring cable. I helped build that plant in Boonville, and ran the process engineering out of Rome during that time frame, then ran the Boonville plant and Rome plants both until I went to Kraft. I ran the maintenance department at Kraft for 2 years, and then went to EMS. I have a bachelor's of science in business management. I do have a rich family heritage in the fire service. My grandfather was in Lions Falls Fire Department for almost 60 years. I am interior certified, was a past assistant chief. I obtained my BLS certification in 2014, and my paramedic in 2016, both as a volunteer while I was working full-time. I joined LSR in summer of 2017 as a per diem medic on the street. But as we're going to talk, took a significant pay cut to work EMS. But I put in there, I loved what I did. I enjoyed the work. To give back really was fulfilling. As I started in 2017, I became a training officer. In 18, I became captain. 19, I took over the operations. So we've been talking about EMS and the status of EMS for years now, and I've seen it in the entire time I've been in, especially in the professional entity. I put some numbers up here and I shared with Tim for your viewing the report that I got these out of that came from the Department of Health. It's a 2024 update on the EMS workforce shortage titled "Where are the Emergency Medical Responders?" So we're seeing a decrease in certified providers every year. And we're going to talk later, but more so even on the volunteer side. So the total number of active certified providers decreased by 17.5% between 19 and 22. 58.4% of New York State EMS agencies indicate the decline in certified responders inhibited their ability to cover calls. And honestly, it's getting more stringent. 37% of respondents plan to leave EMS within the next 5 years. And to put this in perspective, if you look up the lifespan of a provider, it's somewhere between 3 and 5 years. They're in and they're out. 45% of respondents plan to leave EMS within the next 6 years. So the longer they stay in, obviously, the higher the percentage are getting out. And 52% of respondents either don't believe or are unsure of a long-term career in EMS. Now, if I can put some priority on this, the longer that an individual is in EMS, the more they know, the more valuable they are. And these people are coming in and out within 3 to 5 years. By the time they're starting to get a little bit seasoned, they're starting to understand, they're getting really good at what they're doing, they're leaving. The total number of ambulance services decreased by 9% between 2019 and 2022. And the alarming portion of this, as within our own county, Harrisville, just announced they're just shutting down. They're done. North Shore Ambulance and most recently Sackett Harbor. Sackett's Harbor closed their doors. Now, when they close their doors, somebody's got to pick up the pieces. All right, I want you to think about that in Lewis County. As we go through this, if search and rescue tomorrow were to close its doors, who's going to pick up the pieces? It's going to be horrible. All right, and then we talk about the volunteerism. 52% of agencies utilizing volunteer responders reported that timely EMS responses within the community was moderately or severely impaired by staff shortages. Volunteerism used to be, it was a pride. It was a big thing. And nowadays, to get people to volunteer is difficult. And it doesn't matter whether you're a volunteer fire agency or if you're search and rescue. It is tough. 29% of agencies reported frequent delayed response or missing calls due to personnel shortages. 2/3 of volunteer hybrid agencies, such as Search, reported their number of certified volunteers decreased over the last 3 years. 16% saw a decrease of over 25%. So the numbers of volunteers are just significantly dwindling. Lewis County has utilized volunteers for many years, but in recent years, volunteerism has fallen to all-time lows with no signs of improving. And I took a look at I think Mr. McKenzie can speak to this. Of the 6 volunteer agencies that are still providing an ambulance service, 5 in the south and Beaver Falls, most of them are relying on 1 or 2 people to run these calls. That's what they got that are really keeping them held together. They have limited availability because, having to Betsy, they have to work. And for us, it's hard to predict their status as far as being in service, out of service, and trying to cover staffing for that. And we can, last week was a prime example. When you have something that happens in the southern part of the county and we're coming out of central, time is of the essence. And when it's 13 to 15 minutes, shooting an ambulance down 12, that can make the difference between somebody having a positive outcome or not. The call volume in areas combined will not sustain a standalone organization. So these are some numbers we've run as well. And I ran them with my predecessor years ago when he was staff intern part-time. There's not enough call volume in the entire southern portion of Lewis County to put one entity. If you were to even pay just a medic and go with volunteer drivers, there's not enough call volume to return on the insurance reimbursements to cover your costs. There's only one ALS agency in the south, that's Lions Falls. There's one in the north, that being Beaver Falls, but there's limited availability there as well. So then the paramedic level services are coming out of Lowville at a Search, or they're picking Boonville up on the way down. And then if you take Boonville's got a large area that they have to cover as well. And when you're taking their one medic out, somebody's got to backfill that void as well. So it's stressing the paramedic resources. Expenses to maintain volunteer services are a burden. And I can talk to medical expenses as far as every bit of equipment that we purchase, have to replace, the prices just continue to go up. Every time I call and get a quote on anything, monitor, stretcher, you name it, they give me a quote, and then as soon as within 30 days, oh, that's going up 15%, that's going up 20%. It's always going up. And contract money received without providing appropriate services. So there's contract money that is being given to volunteer agencies to cover those towns. That's a commitment to cover the EMS service in their towns. But with the lack of volunteers and the lack of hours available, they can't cover those calls. That's where search comes back in. On our standpoint, that's on a volunteer standpoint outside of search, and on our standpoint, volunteerism has dwindled. I mean, we've been seeing it go down and down and down and down and down every year. I mean, obviously COVID desecrated it. It has not recovered at all since COVID. Staffing is more difficult to obtain as there are significantly fewer certified EMS providers in the last 5 years to replace those moving on. And we saw this more specifically in the COVID times when there was a lot of providers that got out of EMS totally. They did not flood back in. Previously, what would happen is you would work 2, 3, 4 jobs to make a paycheck. And then all of a sudden people left, and now they could get all their hours they need plus in their core locations. So we end up losing people. Retention. People are leaving for higher paying jobs with benefits, less stress, and better work-life balance. And let's be honest, in EMS, we'll talk about the finances later. It is, for the level of responsibility, the pay is way under what it should be. The amount of stress that an individual is under and work-life balance, I couldn't tell you the last time I got home before 9 o'clock at night. And it's either, I mean, my role is a little different, but it's not atypical to have a call come in at 10 minutes to 6 when you get out at 6 and not get home till 9 o'clock, 10 o'clock at night. The inability to retain employees means we lose experience. And again, I want to harp on that, because the longer an employee and longer a medic is in the field, the more they learn, the more they retain. Insurance reimbursement rates are deplorable, making it difficult to provide high quality equipment and sustain wages with benefits. Now, I wish I had put in an additional slide that I can forward to Tim, came from Onion, and it's a graph of all the New England states and what the Medicaid reimbursement rates are. Okay, if you look at New York State, I believe the ALS reimbursement rate was approximately $260. If you look at Pennsylvania, it was almost triple that. We're getting paid $3.09 a mile. Pennsylvania's getting $13 a mile. So New York State by far is the lowest reimbursement rate for Medicaid by a long shot. And again, one of the reasons that's aiding in the difficulty to maintain an agency. So on a volunteer standpoint, I went the wrong way. Here we go. All right. So why are volunteers leaving? All right, we've looked at this too. Now, the training requirements to retain state and regional certifications. We've always had to train, we've always had to maintain, but they become more stringent. Now, on the state side, they backed it off a little bit. They've done a couple of good things. They've backed off the BLS requirements for recertification, and they've extended from 3 years to 4 years. So that is a help. Regional certifications, BLS providers have to do regional skills once a year. ALS providers have to do it twice a year. Increased time away from family, transferring to appropriate facilities. Now, this is a big one. There are many times where our local hospital cannot, and I'll use, for example, something simple such as a dialysis patient. If you have a sick dialysis patient, do not bring it locally, because the concern there is that patient's got to be admitted. And then even though we have dialysis in the same hospital, they're not the same entity, they cannot get dialysis, they have to be shipped out. Wall times at overcrowded ERs. And I'm telling you that it's not atypical to stand anywhere from 1 to 3 hours with a patient against a wall waiting for a bed once you get there. Training and conferences, there's a constant level of training and things that they have to go to. And one of the biggest ones is the state requirement for electronic PCRs. Okay, for me, writing approximately 400 charts a year, it'll take me about 35 to 40 minutes to write a chart. But somebody who doesn't do it all the time, it's not atypical for them to sit there for an extra hour after their call's over to write a chart. Employer restrictions, I think we're going to see this both on the fire and EMS side, but nowadays, fewer employers are accommodating people leaving to take EMS calls or fire calls. Limit availability due to work schedules. And then I put this in, and this may not be the right way to say it, but overall lack of volunteerism pride. Back in the day, people were excited to volunteer, to give their time, and they took great pride in it. And nowadays, whether it be busy lives and families and all that, they just can't find the time. And even in my own entity, I find that those that volunteer want to get paid as soon as they can. They don't want to give their time. At Search, the biggest things we're seeing as far as retention and holding on to paid staff is inadequate pay and benefits. And to be honest with you, I cannot provide benefits for all my paid staff. I cannot give all my paid staff full-time benefit or full-time positions, even though they pull full-time hours. Because again, reimbursement rates, we do not have the funding. So these numbers again come out of the SEMSCO survey. 65.7% of respondents cited inadequate pay and benefits. 51.3 reported availability of better job opportunities outside of EMS. And that's just in New York State. Now, if we look nationally, same thing. 60% cited better work-life balance and 47 cited better pay and benefits. Now, we look at career wages, your basic EMT wages. 45% of EMTs report having a base wage of $19 an hour or less. And then we started comparing to some of the similar things. Convenience store shift manager, 18. Salary of a retail, 19.23. Data entry keep, $20. Now, none of those jobs come with the stress of walking into unfamiliar places, dirty, unkept places, dangerous places, the stress of keeping somebody alive, the worry of all of what EMS brings, and they can make the same money. That is why people are leaving. EMT salary range in Lewis County, our basic EMTs are $17 to $19, and we've increased that $6 an hour over the past 6 years. And we've done that to try to retain employees. Now, EMTBs, many times in many places, is considered a stepping stone. This is your entry level. Get in and move up, right? So we're going to come in, we're going to work as an EMT basic, not expecting a ton of money with the anticipation that we're going to move up. So we look at paramedic wages. 35% of paramedics report having a base wage of $29 an hour or less. 61% report having a base wage of $34 or less. The average salary of a paramedic is $29.58. The average salary of firefighters is $35.35, and the average salary of a registered nurse is $48.14. Now, I want to point out the registered nurse because the registered nurse schooling and the paramedic schooling are very similar. The difference between a registered nurse is they have a controlled environment, they have a doctor over their shoulders, they have multiple staff with them. Paramedics do not. They go out in the field and they got to handle it themselves. All right, they have to make split-second decisions instantaneously within a scope of practice. They have to administer drugs. They have to extricate, all without any kind of oversight behind them. Paramedic salary range at Lewis County Search and Rescue is $25 to $27 an hour. That's an increase of $8 an hour over the past 6 years. And 68% of responding paramedics admitted to considering a transition to a different healthcare profession. Why? To make more money. I can go be an RN and make $100,000 a year. Why would it be a paramedic for 40? Corrective measures we've attempted to take to retain, we increased our wages from $20 to $25 an hour in attempt to draw talent. Unfortunately, it failed. Why? Because everybody around me, all it did is force them to do it. Next thing you know, everybody else raised their wages. And what did we do? And what did that mean? It meant that we couldn't fund other things. So we can't provide benefits and retirement due to revenue streams. Your quality talent is hard to find. So many agencies are taking what they can get. And what I mean by that is if you have a card and you have a pulse, they'll take you. Doesn't matter if you've been to 3 different agencies and been fired from every single one of them, they'll take you because they need somebody in the seat. Now, I want you to think about that as somebody who's coming to take care of you or your family. Those are my concerns. We are more selective, but again, we're investing more money into overtime right now because of a lack of quality providers. And our providers come from an array of areas. We have people coming on a per diem basis from Syracuse, Adams, out of Carthage and Jefferson County. And in the last 6 months, we've hired one out of Vermont. So they're coming from different places. The reasons for the workforce shortage, a need for EMS responders to meet increasing demand for ambulance service due to aging communities, of which we have one. Substance abuse, we see this all the time. Behavioral health and chronic care needs. This is typical. This is a spitting image of Lewis County, although it's statewide. Low wages and lack of benefits for career EMTs and paramedics, despite the tremendous responsibilities that come with the job. I mean, if you were to go talk to a paramedic or an EMT and ask them, how often do you have dreams at night of the things that you've done? And I guarantee every one of them is going to tell you that they have them all the time. Very limited capacity to raise wages due to declining financial health and negative fiscal outlook facing most EMS ambulance services. Many insurers, including Medicare and Medicaid, pay EMS agencies less than their actual cost of providing care. Dead honest truth. So we're riding the backs of commercial insurance companies that are paying better to make up for what Medicaid and Medicare are paying. And then we hope we break even. A decline in the number of new volunteers replace long-term volunteers aging into retirement. Here's a big thing. The more volunteers we have, the less paid staff we have to have. But unfortunately, the volunteers are going away, so we have to increase paid staff. And significant delays in turning patients over to hospitals due to emergency room crowding. You know, providers don't want to stand up against a wall for 3 hours. So the resolution, you know, what are we looking at and what's the proposal? Okay, so I'm going to throw a bunch of stuff at you guys. And I'm going to be honest, right out of the gate, we've had some conversations. You're going to see some numbers that'll probably make you gasp, but we'll put it into perspective. So there's this bill, that's 4020C, designating EMS as essential service going through right now. You know, when it's going to go through, I mean, I think the general consensus, it's going to get passed. In what entity and what it means will be determined. But the goal of this bill is to make emergency medical services an essential service. And in theory and in short, it'll put the onus back on the towns to provide an EMS service for their people, which in theory would be either have your own ambulance service or to contract with an ambulance company. And it allows provisions to set up special districts for the financing and operation of general ambulance services by following procedures in town law as are required for establishments of fire districts. All right. Now, as we get into this, you know, and I'll talk this EMS proposal compared to a fire proposal, but I put a 2, 3, 4. And here's the thing. When I propose this, I've written up a budget for a four-tier system, and that's a 4-crew system. All right. It's a development of a countywide EMS system. And I feel it's essential for the continuity of EMS services. And I'll talk to this in detail. But the four provider system, it'd be funded through insurance, reimbursement, and town contracts. So we still bill insurance. Every dollar we get offsets the budget, and then the town contracts pick up the rest. It's a similar model as today. However, increased funding will be required from the towns. We have town and village contracts now, but out of 10, we contract 10 out of the 17 counties, and we collect $70,000 total. Most contracts are roughly $2,000 to $3,000 guaranteeing an ambulance. That doesn't cover the 2 calls, let alone 1. The proposal of a 2, 3, and 4 paramedic crew plan to cover the entire county with bases strategically placed throughout. And the bases, would be in the general areas of the Croghan, and that crew would cover from Croghan all the way to Harrisville. A crew in the south, somewhere around Turin, Potters Corners area, and 2 crews central. And with a 4-crew system, it allows us. We also have mobilization strategies to cover the entire county. What I mean by that is this. So if a southern crew goes out and they're on a call, we have the ability to mobilize one of the 2 central crews down south to still maintain that quick response so that we're not coming out of Lavelle. Same for the north. If the Croghan crew goes up, one of the Lavelle crews shifts. That way we have coverage fluently throughout the entire county to make sure that we have timely response. The advantages of a 4-crew system: cost savings and reduction of duplicate operational items such as equipment, software, insurance, and other operational expenses. Many of us use the same things, whether it be EPCR softwares, training softwares, and we all have our own individual insurance companies, of which, you look at the benefit of consolidating all of that, and you have the reductions. Reduction in total ambulances countywide. My recommendation was 13 to 9, and that 9 is 5 central, 2 south, 2 north. And that way you still have, and you're only going to be utilizing 4 of those ambulances at a time. What that allows is for additional providers within the county to jump in the empty ambulance and still perform a service if you were to get busy. Improve utilization of providers. Now, here's the thing. We currently have paramedics in Constableville and Port Leyden. Okay, but those are both BLS ambulances. They can only run at a BLS level with those ambulances. Lyons Falls has an ALS ambulance, but they've only got 2 providers to run out of that. So we're not utilizing our paramedic level as well as we could be in that area. Now, if you go to a a four crew countywide system, they all fall under the same umbrella. They can run out of any ambulance within the county. So it doesn't matter where that provider is. If he's coming back from the Watertown, happens to be coming through Lavelle, he can get in a rig. If he's at his home in Port Lyden, he can get in a rig. If he happens to be at Harrisville, he can get in a rig. And he'll have everything he needs. Improved cost sharing for supplies and maintenance. Obviously, the more we buy, the better pricing we get. In-house billing. So each of the ambulances in the south pays a service to do their billing. That would all be brought in-house. In-house HR and payroll. Again, they don't have to hire somebody to run payroll and take care of the HR services. Employ current volunteer providers. And I've seen on Facebook more than once, providers that volunteer said, hey, I wish I could get paid for it. Now they can. And here's the other thing. This isn't pushing out the volunteers. They can still run. They can run as ALSFRs as well, which is Advanced Life-Saving First Responders, meaning that they can still respond to these calls. They can still perform care, but then they would turn that care over to the transporting agency and they go back to bed. So they can still maintain, they can still volunteer, they can still fulfill their scope of practice. Faster response times, more fluid reporting for towns, uniformity in training. Oops, I went the wrong way again. Get used to it. Okay, provide the pay and benefits necessary to make EMS a career. And what we want is we want these people to come out of a program young. We want them to learn. Some of them are going to move up into the ranks. I'd love to have one of our students that came up through and ran become the next medical director out of Lewis County. But some of them are going to stay and make this a career. Bring compensation in line with similar services. Reduce burnout through better work-life balance. Reduce overtime. Provide more days off to decompress. And again, through better schedules, whether that be a 4 on, 4 off, or a schedule to get them more downtime. Shared pivot services. Now, we hire Pivot every year. And it's a free service to our providers, and it would be an extension to all employees throughout EMS in this 4-crew system. Improved competencies of providers through 100% peer review. Realized gain from interfacility transports from other hospitals at critical care levels. So now, again, with more providers in the system, we can now help out neighboring agencies and gain some additional funding by taking some of the interfacility transports out of our area. And I say ALS too. We have a critical care transport policy agreement with our hospital, our med director, that allows us to take vent trips, blood trips, things of that nature, of which you are able to charge more for that level of care. And career advancement opportunities, EMS include leadership and training roles. Now, here's the nuts and bolts. The total expense for this, as I wrote it up for a 4-crew system, would be approximately $5.4 million. And of that $5.4 million, employee compensation being pay, benefits, taxes is $4.6 million. So a large majority of that expense comes at the price of paying providers. All right, so total income minus contracts. So again, if I took the total insurance billing anticipated, insurance billing would only cover 1.89 million of it. Insurance billing, it is tough. So in that 1.89 million, it includes your insurance billing, donations, sale of equipment, recertification revenue that we get from the state. Every bit of revenue I could get that was not a town contract. Thus, it would leave a balance of 3.5 million left to run a 4-crew system. Now, this here, what I put up here is just a real quick indicator. So when I looked at our contract value, I bounced it against population, okay? And when we go back through and I show you the next slide, what it's doing is it's realigning. So it's realigning contract dollar percentage to total population percentage, okay? So in theory, your total population percentage should match your contract percentage, but right now they don't, because obviously the populations have changed. Now here's where the numbers fall. For each one of the 17 townships, there's a total population, and I took the total 3.5 million, divided it by the percentages, and said, okay, of that 3.5 million, if you're 10%, in the 10.44, you get 365,000, that's your need. I added in the equalization rates to come up with the rate per thousand. And again, I want to thank Mrs. Aiken for helping me through getting me some of this information. But there on the right-hand side is the rate per thousands based on equalization rates. And there's things, there's certain townships obviously that have, are broken out into two different fire districts. One fire district may pay less than the other. I took that into consideration when I did this as well. So I know that's a big number. When we start looking at these numbers, it's a big number to eat and it's a big number to look at, but there's a few things I want to throw into perspective. In this entity, we're asking for 3.5. The fire service right now gets $1.4 million and they don't have a stitch of labor in there. So they're getting tax dollars of $1.4 million just for equipment alone. Our budget, if you were to take a labor out, is less than $1 million. It's labor that we're looking at. And again, I think the average, we talked town of Denmark average at $1.40 per thousand for roughly a $250,000 house. You're looking at an increase of about $250, $20 a month to make sure an ambulance service, well-trained, well-equipped, shows up to your door when you need it. Because right now, there's no guarantee. All right. Personally, I've been involved in EMS leadership since 2019, actually 2018 when I became a captain. I brought an agency out of near bankruptcy. All right. When I took over search and rescue, I opened QuickBooks. It was red, said negative $12,000. And now we sit at approximately $1.2 million that we sit on at the beginning of every month. It doesn't go up, doesn't go down. And some of that is from donations and some of that is from just managing your expenses. We've seen EMS crumble over the last 7 years. We brought in an agency through a pandemic. That was rough. And we've worked diligently to find ways to mitigate the effects of crashing system. And one of those is proposing the BOCES program, which again, I want to thank, Lewis County and the legislators for assisting with that and getting that off the ground. But here's the thing. Our next step is give these kids that are coming out of these programs a place to work and live. Been a part of the ad hoc committee since it started and part of the EMS council meetings. I'm involved in EMS heavily. And I see a clear need to bring security and standardization to EMS within our county, especially as our population ages. Combo ALSFR, BLSFR, coupled with a countywide system secures our future and would encourage more Lewis County graduates to enter into an EMS career and make it a career. Sorry, I went a lot. Tim gave me 10 minutes. I know I rambled a lot longer than that, so I apologize, but there was a lot there to give you guys.
Josh, do you have a pro forma or financials or anything that you've drawn up to support these numbers? Can you share that with us?
Yeah, I can actually send those out. I do have them here. I have them with me, but I can email them.
Okay.
I have a few questions. So, what's the current amount you're receiving from towns and villages? versus
71,000.
71,000?
Yep, total.
And then the 4.6 million for the hourly wages, but what's the hourly wages if you're reducing overtime? Like what
Sure.
what is the hourly rate?
Like the hourly rate of a paramedic was set at $50 an hour. And I think a basic was 25. Give me 2 seconds. I'll tell you exactly what I brought it up. But it was in that range.
Okay.
Yeah, basic EMT was 25. Advanced EMT was 35. Paramedic was 50.
And that's with burdens and everything?
That's the hourly wage. And then you add on top of that benefits and 401k, things like that.
So the thing with this whole thing is so you're looking for 3.5 million of taxpayer money.
Correct.
And to me, there's a governance problem there.
Mhm.
So you have a board of directors. How is your board made up?
Board is made up currently of 7 volunteers, non-paid volunteers, and we have 2 open seats for outside individuals. So we just changed our bylaws this past year to bring in some outside resources for 2 reasons. One, we wanted the expertise from outside. maybe legal expertise, maybe financial expertise, somebody else to take a look at what we're doing. So we opened that up. And the other is, to be honest with you, it's getting harder to find volunteers that want to sit on a board of directors.
So I mean, if taxpayers were gonna fund this, in my mind, elected officials have to
Sit on that board.
have to sit on the board, or, you know, if the towns are gonna fund this, they have to have appointees on your board.
Absolutely agree.
And my last question is, can we see your financials?
Yeah, I told Larry, you want to see our existing financials? I have
Yeah.
no problem sending you that. And I'll send you the proposed as both. I have no problem with that.
Thank you.
Josh, I've got, I guess, an observation and a question. When you hit up there, drawing your paramedics from all over different areas, and I've noticed it when I've linked up and seen, I don't recognize anybody. Is there a reason we don't have Lewis County paramedics?
They're not here. And there's a few of them. There's a couple that have been with us. You know, you're looking at, 2 or 3 of them that have been with us for a while, that have moved on, gone other places.
Reason why they wouldn't stay in Lewis County? What's going on?
There's multiple reasons.
Okay.
Yeah,
I just don't see any local ALS providers.
I agree
Except
with
I
you.
see you,
Yeah.
but I don't see anybody else from Lewis County.
Yeah, we got a few. We got a few that are from actually Lewis County. A lot of them are from Jefferson County, and I'd love to keep them from in Lewis County. I really would. But again, through there were some. There are definitely significant reasons why they're not providing anymore, and not necessarily for this committee, but yes,
Yeah, I was just wondering why we don't see them.
I'd be happy to have that discussion if you want to come sit with me at any point in time.
Okay, thanks, Josh.
No problem.
So we've been discussing this for a long time on the EMS ad hoc committee. We're thinking that maybe we should do a survey or study countywide with someone that's in that business to ascertain, what the best path forward is for the county. Is that something that you would support if we were to do that?
I'm going to tell you that I'm not going to stand here and say, no, that's not a good idea. I think my opinion based on what I've seen is that you're going to spend probably a significant amount of money to figure out what we already know. But if that second opinion, by all means, because we are talking a lot of money, by all means, I worry about spending the money if we don't need to. That would be the only thing.
I think it would give us a better handle on how to structure a network or a system that would work for our county, because it's so rural. We have no urban area that, obviously supports other areas.
Mhm.
We don't have any of that support. I'm a little concerned with the money that you're talking here to set up this system. I'm concerned it would create a huge backlash with residents. I think we really need to do a study to understand the problem the best we can.
Yeah, and I understand that. And I understand also very simply, I understand that when you look at it myself, my taxes go up $100 a year. Why? It's that communication. I think it's that how we communicate and how we present this so that they understand, because I think the large general populace does not understand EMS, how it runs and how it works. They just dial 911 and somebody shows up at their door. They have no idea. And I think there's a lot of education that needs to happen in order for people to understand and accept any portion of this.
And to go on to the study, you did a very good job with your presentation, and I appreciate that. But we're all in Lewis County, and we're dealing with this problem, and we most likely have all of us have blind spots to this. When you're busy in the ditch digging, you can't take that 1,000-foot view. You can't see everything. So I think it's important to get an outside perspective, that 1,000-foot view to really look at everything.
And absolutely, and be honest with you, I'm coming and saying, here's my view. What makes my view the right view? I agree with you. Again, my concern is, knowing EMS and being in it and watching it over the last 5 years, seeing what other counties are doing. Again, we talked about that at the ad hoc committee, right? Looking to see what they're doing. And maybe there is a different hybrid version that works. I simply took a look at it and said, how do we cover the entire county, make sure that people get an ambulance when they call in a timely manner, and keep them around?
I think we need the study. I agree with both of you that this is an awful lot of money to pass on to the taxpayers. I think we need to find the best way the county can do this. It may be this idea. I'm not saying that it's
Nope.
not, but I think we owe it to the taxpayers if it's this much money to make sure we're doing it prudently and the best way we can do that.
And let me be very clear, you're not going to insult me in any way, shape, or form by doing a study, not in any way, shape, or form. I see a problem. I've been trying for years to put a patch and a fix. And again, that's where the ad hoc committee came. We've been working on that, and we just keep going down the same road. And with this bill coming out, and again, that's an opportunity for us as a county to get ahead of it and try to figure out how we're going to deal with that when it comes out.
Just,
Well, that bill really doesn't solve the financial problem. It gives us another option of how to proceed with it. And really, that's all it does, I think, basically.
It puts some onus back on the towns to make sure that their people are covered, right?
It gives them the ability to be able to form a special taxing
Tax district,
jurisdiction, but, money is still money.
They
So
still got to come up with it.
whether you pay $7 for county tax and $2.14 for a EMS tax, or you pay $9 for a county tax, it all comes out of the same
Right.
pocket, basically.
Any other questions for Josh? I would like to say that I feel we are in a difficult situation, but at any point in time, if you don't know what EMS is and you dial 911, you certainly will learn what EMS is. Thank you, Josh.
Mhm.
Levesque.
So, Tim,
can
is it-
someone make a motion to go
Yeah.
out to RFP and we'll have that ready?
Okay, second. Okay. Thank you, Tim.
Thank you.
And I think we're ready for draft resolutions.
Okay, the first one is authorizing intermunicipal agreement between the County of Lewis and the Town of Lovell for flood damage prevention, administration, and enforcement.
All in favor, say aye. Any nays? Carried.
Pursuant to local law number 2-2007, finding and determining that an unsafe structure at 1057 Ammon Road in the hamlet of West Leiden shall be demolished and removed, and to set the hearing for final order.
All in favor, say aye.
Aye.
Any nays? Carried.
Authorizing the Lewis County Building and Fire Codes Office to amend its fee schedule and to post once adopted to the county website.
All in favor, say aye.
Aye.
Any nays? Carried.
Appropriating $34,118 in New York State grant funds and transferring an additional $36,312 in Board of Election account lines to acquire new poll pads, printers, and cabinets for polling sites.
All in favor, say aye. Any nays? Carried.
Accepting ownership and responsibility for specific Town of Krogan bridges located at Long Pond over West Branch Oswegatchie River and South Bridge Street over Beaver River.
All in favor, say aye. Any nays? Carried.
Accepting ownership and responsibility for a specific Town of Diana Bridge located at Jordan Falls Road over Middle Branch Oswegatchie River.
All in favor, say aye. Any nays? Carried.
Accepting ownership and responsibility for a specific Town of Leiden Bridge located at Brock Road over North Branch Moose Creek.
All in favor, say aye.
Aye.
Any nays? Carried.
accepting ownership and responsibility for specific Town of Laval bridges located at Gordon Road over Mill Creek, Bardo Road over Mill Creek, McHugh Road over Mill Creek, and Bickford Road over Mill Creek.
All in favor, say aye.
Aye.
Any nays? Carried.
Accepting ownership and responsibility for specific Town of Lionsdale bridge located at River Road over Fall Brook.
All in favor, say aye.
Aye.
Any nays? Carried.
Accepting ownership and responsibility for specific Town of Martinsburg bridge located at Centerville Road over Roaring Brook.
All in favor, say aye. Any nays? Carried.
Accepting ownership and responsibility for specific Town of West Turin bridge located at Sweeney Road over East Branch Fish Creek.
All in favor, say aye. Any nays? Carried.
Accepting ownership and responsibility for specific Village of Lions Falls bridge located at Fulton Street over Hoskins Creek.
All in favor, say aye.
Aye.
Any nays? Carried.
Setting a public hearing on the purpose of receiving public comment on the proposed addition of approximately 0.2 miles of the Lewis County OHV trail system.
All in favor, say aye. Any nays? Carried.
Introductory local law number 5-2025, a local law amending and replacing local law number 3-2015, a local law on the County of Lewis to provide a uniform system for managing the collection, transportation, and disposal of solid waste and recyclables, and setting the public hearing.
All in favor, say aye.
Aye.
Any nays? Carried.
The last one is appropriating $97,235 into the Highway Department account lines to recognize additional revenue from the sale of surplus equipment.
All in favor, say aye. Any nays? Carried. We have no motions and no executive session, and I'll make a motion to adjourn. Do I have a second? Thank you.
committee together. Make a motion to approve the April 15th committee minutes if there are no amendments. Do I get a second? Herb? All in favor, aye?
Aye.
Minutes stand approved. First presentation today is a 5-year coordinated infrastructure plan by Cassandra Buell, Director of Planning and Community Development.
Thank you, Tom. I wanted to share with you the background of some of the work that my office has been working on in coordination with John Reed and with various other engineers that have been hired by the municipalities to conduct some of their infrastructure projects across the county. So this was identified as one of the goals of the legislators for this year, is to really come up with a 5-year coordinated infrastructure plan. How can we as a county help coordinate projects so there's not duplicative efforts with engineering, with 1 year ripping up a road for a water project, laying down fresh asphalt, but then the next year landing complete streets funding to complete an entirely new roadway, complete with substantial crosswalks and the sidewalks that are needed. We really found that there was a lack of coordination between some of the projects that the municipalities were coordinating amongst themselves and amongst other entities. So we stepped in to help them coordinate not only just the projects, but you'll find the grants, which has been a fun learning curve, I think, for John. He didn't realize how much effort and how big of a puzzle it is for the grants, but also how much opportunity specifically Grace and I can bring to funding a lot of the projects that he would have been left with funding with CHIPS funding, which our whole goal is to make our municipal CHIPS funding and the municipal taxpayer funding last longer. We really want to leverage our local funds and add to the pot, because a lot of these funding mechanisms that we're utilizing, if we don't apply for them and if we don't utilize them, somebody else in the state and somebody else in the country will. So it is our goal to utilize as much as that as possible, obviously, to what makes the most sense, what's realistic. But we've had some really great luck with the grants that we've been working on in coordinating these efforts. So at the beginning of this, our first project was the Glenfield project, and we were hoping to get the CDBG funding to cover the complete streets portion of that. But there was a caveat with the income survey, which I don't need to muddy everybody with the details of how fun CDBG grant applications are. But luckily, our CHIPS funding was able to cover the roadway infrastructure improvements, which really were focused on the roadway and the drainage issues. But an extra bonus was to implement a bit of the complete streets elements to that. So the first, we recognized, and working with John at the highway department, first and foremost, to identify the priority areas for county infrastructure. Where is he focused efforts on with county roadways to make improvements specific to drainage and roadway improvements? Because our drainage historically, and John, you can correct me if I'm wrong, we haven't gone through the whole engineering to ensure that the proper drainage is applied. We've kind of just slowly continued to spread outwards, right, with the asphalt, which if you go into Constableville and Port Leyden, you will see there is significant drainage issues because of the topography. So our goal is to fix that. And not only will the drainage fix the roadway and create a lasting surface for us so that he's not making those investments every 5 years versus every 10 or maybe even 20 years, but I think we can all agree that communities, it adds to the beautification of the community when you can set a curb to a road, and then you define the grass area between the curb and the sidewalk, and then you add a sidewalk, and then define a grass area from the edge of the sidewalk to that property line. It's really transformational for a lot of these communities that have never had that. So we're really working to implement those complete streets plans that were set forth in our complete streets plan that the county did. And is actively finishing some engineering reports on. And Constableville is at the top of our list, mainly because of their project schedule and the funding that they've already received for the project. Now, I will say this is a 5-year plan. However, it is very fluid because, I mean, just this last week when getting updates from the engineers on this project, we are likely going to have to fit this into or split this up into 2 phases because of the funding that they still need to cover the last bit of costs. So do understand that's the reason why we worked a lot of these grant components in there. So one, we understand the duration of the grant, how many grants we have, what do we need to get to meet our total project cost or as close as possible. And then where are we going to schedule the phase 1 and phase 2, or possibly some of these projects are even going into a phase 3? Because if they have county infrastructure, if they're a county road, that's a big deal to John. Obviously, my office can come in and help with grant funding, but we need to be very careful putting this puzzle together, making sure that he's using his CHIPS funding the best way he possibly can. We don't want to take all of the CHIPS funding and use it towards one project. We want him to be able to spread it out across the county. So leveraging the smallest amount of CHIPS funding as possible and building off of that to get the WIA or the NBRC, the County Infrastructure Grant Program funds, the CDBG funds is the best way to leverage those. So as you can see, without boring you, this is just the Constableville. Here's our Gantt chart and all of our timelines. Here's where we are now. So we have a lot of coordinating that we are doing behind the scenes with the engineers, with John, with the municipalities, because it's not just the engineers and their timelines of construction. A lot of it has to do with their borrowing power, what the bond, you have to go out through the timelines to get that bond approved and to make sure it all makes sense. So again, today, this is what the project schedule looks like, but just know that could change in the blink of an eye when we get maybe a new funding source that may fit for another village that doesn't fit for this village because they have too much funding in this bucket. It may move it up to the top. But the biggest portion that we're seeing is to get those engineering the preliminary engineering and the final engineering done alongside the municipal water engineering. So in Constableville's example, they are moving forward with the engineering for their water infrastructure. And at the same time, we're moving forward with our roadway drainage and complete streets infrastructure that we have as part of the county infrastructure grant program listed up here applied for. Okay. So the costs that we estimate are $190,000 for the engineering for that, which again, we hope to have paid for through the county infrastructure. Do you really want me? I think it's harder to see when it's smaller. Oh, okay. So we have to make sure that our funding is appropriate to what the engineering, can it cover engineering? We purposely want to cover the engineering first and foremost, because we don't want, again, John to have to use those CHIPS funds for engineering. So we are saving money alone just in coordinating the engineering. So for instance, Constableville is using BCA for their water infrastructure designs. We are also going to be using BCA for the drainage and the roadway and the complete streets portion of the project. And just by doing that, I think when we were talking, the engineers estimated between $10,000 and $30,000 just in shared engineering costs, right? And then you get to shared mobilization of the projects when we start digging up the roads. Instead of digging up the roads twice, we're digging them up once. And we're laying that water infrastructure and we're doing the drainage in a coordinated effort. And then we're laying the sidewalk. So just by combining our processes and working with Constableville to give them a little bit more muscle when it comes to grants and coordinating all of that, speaking with the engineers, at least $250,000 in savings alone, just by coordinating the mobilization, the survey work, and doing some of the grant work in office in our department. So that's really great for the village of Constableville, being one of the smallest villages, but we were able to land quite a bit of funding for them to push forward a lot of their coordinated projects, which at this point includes water infrastructure, complete streets, and then our portion is the roadway and drainage improvements. Then we move on to Port Leyden. Depending on how Constableville comes in with their funding and when they're able to kind of put the pen to paper with their construction timeline, we are also working with Port Leyden. So Port Leyden is going to be, as you can see by this project schedule, they're finishing up the final designs, or they're in the midst of their their preliminary designs for their water infrastructure, which we also have to coordinate with because the water infrastructure engineers have to know where the drainage components and all that fun stuff, which John knows a lot more about than I do. They need to coordinate efforts on that. So we're saving money there with those coordinated efforts. And then the final design for the water infrastructure is set to be done December through January of next year. And then our final, right now we're doing just a 30% because we want to give the water engineers just enough information to coordinate that project because they will be going to construction before we will. Their water project is going to be one phase, but our complete streets and roadway improvement project will be 2, possibly even 3 phases. It depends on what the final estimates come back at. And as you can see, we're trying to keep track of the start and end dates, the funding that we've received, the total project costs, which feel like on a month-to-month basis, they just keep increasing. And we want to keep track of how much we save and how much we can coordinate those efforts so that we can report back to both the municipalities and the legislators, because in the end, it's still our constituent tax dollars that we're paying or that we're saving. Next on the list is Beaver Falls. I will say that this was identified as a huge priority because of the drainage issues. There's a lot of subsurface drainage issues that have raised concerns over the past year or two. Longer than that, but I think that they've been raised substantially over the past year or two. And there are funds that can cover complete streets portions of the project, so crosswalks, sidewalks, and then we're looking at other out of the box ways to fund through like flooding mitigation or what have you for the roadway. But I will say we have less of an idea of the construction, the final full construction costs of this, because this is 2 phases. There is the phase that we applied for through New York State TAP funding that connects the Arts Road where the bus garage is near Beaver River Central School and connects to Addison Ave. But the school, we've been working with them because they are reconfiguring their parking lot because that egress and ingress is extremely dangerous, and it's a problem that they've really been working to solve. And that project was approved in their budget, so they're looking at reconfiguring their parking lot. And as part of our Complete Streets effort, we had identified that the best course of action is to make that intersection by Addison Ave into a 4-way intersection with Arts Road. So obviously, that being a town road, we need to work very closely with the town of New Bremen if and when it does get to that point. But right now, we're just at the phase where we need to figure out the estimates for that work and when and if that can be pushed forward. But that was a project that was identified on the TAP application a few years ago that we did not receive the first time around, but we hope to apply for again come July. And then the second portion of that phase is to connect where 126, where the bridge is in Beaver Falls, and loop around Main Street to the following intersection in 126, so that it's an entire loop. The sidewalks are very lacking if you've been in the Beaver Falls area, but there's no sidewalks directly to the school, which has been a problem. Turin, this one is a priority. I will say that if we are able to get funding to cover the costs of this project, it is likely to move up. But right now, without the project costs, it will be after Beaver Falls. But again, it's not dependent on a water infrastructure project or a sewer infrastructure project. So there's a lot, it's easier for us to plug it in sooner than it is the other projects because we're coordinating. Like for Beaver Falls, we'd be coordinating with the school schedule. For Port Leyden, we're coordinated with their water district improvements. And then for Constableville, we're coordinating with, 3 or 4 projects. So this one is a bit easier to plug in and match it to whatever funding we can access for that. And Lyons Falls is one that we're working on, not with Lewis County Infrastructure, but we're trying to coordinate 3 projects with them as well. They were a recipient of New York Forward grant funding for Complete Streets, so $1.9 million there. They have received WQIP funding and WIA funding for their wastewater. And they're they're just finalizing the PER that you all helped to fund to access funding for this fall that should be announced this fall. The CFA was just announced, so they'll be applying for the funding now, and hopefully they receive the funding for their water infrastructure in the fall. And so this will be a three-fer. So they'll have the wastewater and the complete streets elements and the regular water system all trying to work cohesively. The wastewater is a little bit easier because there's no infrastructure that like under the roads that needs to be replaced or worked on. But we do need to coordinate the actual water infrastructure and the complete streets. So as you can see, we've already listed proactively where we need to be looking for funding and when that will hit. Here's our fund implementation schedule. And I mean, you may recognize the East Martinsburg Road that obviously we're going to be working on simultaneously with John because it is a county road. Some of the funding that we've applied for, unfortunately, both funding streams have been pulled with the new administration. So we're keeping this on our close to the top of our list because it is one of the things that probably falls that gives a lot of frustration for both John and the roadway users there. So keeping that on the forefront. And then here's some miscellaneous projects that we have on our list, but we haven't dug into in the 5-year plan, but they will likely be beyond the 5-year plan. They're just not of purview as of yet, and they were identified in the complete streets plan. Any questions on all this fun that we've been having? None?
Anybody have any questions?
Oh, Josh. Oh,
I don't have a mic.
oh, are you?
What I found being in the industry, just to summarize what we've gone through in turn, we started discussion in 2022. We got our award letter in December of 23. And I think the key is, and we started construction now 2 years later, but the key is to share the legislators or Cassie, she does a great job with the towns and the villages, is the funding stream is very slow with these projects. We still have not received $1 from our grant yet. We've taken a bond anticipation note twice to fund the project because as years go by, costs go up 10%. And with that, with grants, you have to administer and adhere to the state specs. The PEM spec for concrete has increased concrete from $200 a yard to $750 a yard with a $100,000 engineering design. So the cost substantially goes up. So it's better to borrow money at 4% than pay a 10 to 20% increase by kicking the can down the road. So your initial budget will become less. Your budget will be the same. You'll do less with the same amount of money, which should be coordinated with the towns and villages on how the funding stream works.
Right. Which is why I say this is very fluid,
Yeah.
because it will 100% depend on the status of the village and or town and where they are with getting and securing the actual money. I mean, getting the grant is one thing, but like Josh has alluded to, that grant may not hit your books for another 2 years. So, right. So that's what adds the fluidity of this, and because you never know what grant you get. So any other questions?
Anything else? Thank you very much, Kathy. Next, we have a presentation on county assessment services for the towns, a discussion with Candy Aiken. Candy?
So I didn't prepare a presentation slideshow for it, but I think we've discussed the county assessing several occasions, so you guys all are aware of what it's all about. However, we found ourselves in a position now where we've contracted with the town of Croghan for assessing services, and now our assessor has put in his resignation. So that leaves us at a point in our office where we do not have a qualified person to fulfill that role or that contract that we have with the town of Krogan or any other town for that matter. We have received a lot of interest from towns about contracting with the county for this. We are contracted with the town of Diana for data collection services, and I think that's been going very well. So I'm kind of at an impasse here and looking for some direction from you all as the board as to what direction you would like my office to continue going in. Some concerns I have that I've discussed with Tim on different occasions is I don't want our office to become a revolving door for training, having the county pay for the training, and then the assessor leaving to go contract with towns on the at the county's expense. Not to say that it's not good for the county to promote having well-trained assessors, but there's no guarantee that they're going to take towns within Lewis County either. They could be taking towns in other counties as well. So we're kind of at a point where each county assessor or each assessor for towns are on a 6-year reappointment term. The term ends September 30th of this year. So it's going to take, unless you guys want me to keep moving forward with this initiative, I can post a position and hope that we do get a qualified person to take over this role. But when we posted it last time, we only had the one applicant. But that was over a year ago, so maybe there would be more interest. Because we're at an end of a term, we do have anticipated openings. And I have 4 towns that currently are interested in coming on board with the county. Towns are limited on the options that they have to get around the 6-year term. And one being they can contract with the county, but like I said, we don't have a qualified person at this point. And the other is they can appoint somebody as an acting assessor, but that's only for a 6-month period. And the appointee has to be certified within 6 months. And at this point, I do have an internal candidate that is interested in getting an assessor designation, but the problem is he would not be able to be certified within the 6-month period of time if we were to contract with towns for assessing services. So what's happening is the towns that did come to me with interest and asked for IMA agreements, I've kind of placed them on hold until we've had a chance to discuss what direction the county legislators would like us to go in. I'm not sure if you've had any of your towns reach out to you to give you any input. I've gotten a lot of input back from the towns that were interested in going with us. But ultimately, it's going to be your decision on what direction you want the county my office to take going forward.
So I've had some discussion with the town of Diana, and the data collection has been going great, and they all are very appreciative of that. I think the county assessor was a great idea, but yeah, unfortunately, I mean, they're making too much money working for multiple towns, and I don't think we can compete in that market. They're making 6 figures, so. Yeah, unfortunately, I would be in favor of continuing with the data collection and helping with that. That's taking some of the load off the assessors for the towns and making things a little bit easier and helping them keep everything level across the board.
What is the status of the Krogan? Is that finished, or is he going to stick around long enough to finish a Krogan assessment?
So he is doing a revaluation for 2026 for Krogan. And the town of Krogan has met, and they are planning on appointing the assessor that we currently have at the county level as their sole appointed assessor. And he intends to complete the 2026 revaluation project for Krogan. So that will move forward. It just won't be under the direction of my office.
So Krogan pays better than the county?
Well, not individually, but as, I'm sorry, I'm drawing a blank. Herb said that the towns, what happens is the towns each pay, say they pay $20,000. Well, if they take on 3 towns, they're making more than they can make at the county level. So,
And it's
And
not
some of
uncommon
them-
for them to take on 10. And Krogan paid their last assessor $40,000 a year, and that was just one of 10 towns that assessor had. So they make very, very good money. The other thing I would point out that Candy didn't mention, that has concerned me from the beginning, is in Krogan, when they do the reval, people are going to be very upset. It's been a long time since they've done a reval. And if that person was working here, even though we were doing it for Krogan, I'm afraid the legislators would be hearing it from the constituents that this was the county. If he's working directly for the town, it has nothing to do with us. And just to point that out, it was a nice shared service, but I was a little worried about the ramifications because people are generally very unhappy when assessments are done, especially if they haven't been done in a long time.
Any other questions? If not, thank you very much, Candy.
thank you.
And we were going to have a presentation on cell phone usage, but Joan isn't here, so I guess we're going to move on to our resolutions.
Okay, the first one is authorizing an amended agreement with Quantify Consulting LLC to provide the professional services, software, and analytics outline in its 3 proposals at the total cost of $28,300 and to transfer said funds from contingency to legislative account lines.
Any questions or comments? All in favor, aye.
Sorry.
Opposed?
Yeah, I got a
Oh.
comment. Where are we on the dashboard for the budget on our website
This is authorizing us to move forward with that.
with that?
Yes.
Okay.
Yep.
Okay.
Any other questions? All in favor, aye. Opposed? Carried.
Authorizing an agreement with BCA to provide engineering services in an amount not to exceed $190,000 for the roadway and complete streets improvements to County Route 52 in the village of Constableville to complete preliminary design, final design, bidding, and construction administration, and additional engineering and consulting services in an amount not to exceed $55,000 for anticipated services such as base mapping, topographic surveys, construction observation, verification of existing conditions, New York State DOT coordination, subsurface investigation, record drawings, and reimbursable expenses.
Any questions or comments? All in favor, aye. Opposed? Carried.
Awarding bid and authorizing agreement for the Chevrolet Starcraft 16-passenger bus to Model 1 commercial vehicles at a cost not to exceed $121,750.
Any questions or comments? All in favor, aye. Opposed? Carried.
Authorizing grant applications to the Department of State and the Department of Environmental Conservancy for waterfront revitalization and rehabilitation and flood mitigation in order to fund the East Martinsburg Road, Hospital Hill, and Mill Creek stabilization projects and to authorize contracts for same.
Any questions or comments? All in favor, aye. Opposed? Carried.
Discontinuing assessment services with towns and districts that the position and directs that the position is not refilled upon being vacated.
Questions or comments? All in favor, aye. Opposed? Carried.
Closing the Capital Solid Waste Transfer Station account, HAS, due to completion of project.
Questions or comments? All in favor, aye. Opposed? Carried.
Closing the Capital Data Processing account, HAE, due to completion of project.
Questions or comments? All in favor, aye.
Aye.
Opposed? Carried.
And the last one is awarding bid and authorizing agreement between the County of Lewis and Green to Green Consulting LLC for professional pre- and post-demolition environmental services, including asbestos surveys and air monitoring services for structures that will be demolished by the county at various costs as needed per project as submitted by the bid.
Any questions or comments?
Can we, whenever they complete a project, can we get a report that shows how they mitigated contaminants?
Yes, and this is the first time we've done it, but we're just doing a blanket RFP so that every time these houses come up, we don't have to go back and do another bid.
I will say that most of it will be covered by the funding that we've applied for too with the projects. So,
Anything else? All in favor, aye.
Aye.
Opposed? Carried. And we don't,
Tom, I would ask that we go into executive session. Caitlin would like to update us on contract negotiations.
okay. We don't have any motions. I'll make a motion to go into executive session. Do I have a second? Vince, all in favor? Aye. All right, and we go into executive session.